Good morning everyone. My name is Irene Tricia Barbosa from BSA3, and for today's topic, we need to discuss the differentiating the standard precautions and transmission-based precautions. So when we say, we have here the introduction about the standard precautions. So standard precautions are meant to reduce the risk of transmission of blood, borne, and other pathogens from both recognized and unrecognized sources. So, it means that it reduces the risk of transmission. That was we call the standard precautions. And they are the basic level of infections control precaution which are to be used, and as minimum in the care of all the patients. So standard safety precautions are the basic infection prevention and control the measures necessary to reduce the risk of transmission of infectious agent from both unrecognized and recognized sources of infections. So, what is standard precautions? The tenets of standard precautions are that all patients are colonized or infected with microorganisms whether or not there are signs of symptoms, and that a uniform level of should be used in the care of all patients. So, the elements of standard precautions it includes the hand hygiene, use of gloves, and other barriers like mask, eye protection, face shield, gown, handling of patient's care, equipment and linen, environmental control, prevention of injury from sharp devices, and patient placement, the respiratory hygiene and cough etiquette. That was the standard precautions. Like that. So, hand hygiene, the PPE, clinical waste, patient care equipment, isolation environment, occupational exposure, cough etiquette, spillage are the 10 elements to standard precaution. And as you can see, this is what they call pandemic. We use this kind of precaution in this kind of pandemic, like the hand hygiene. Hand hygiene is a major element of standard precaution and one of the most effective methods to prevent transmission of pathogens associated with healthcare. So, mas pinapanatili po natin yung hand hygiene because to prevent the transmission of other pathogens. Yan. Protocol din po yan ngayon dahil sa ating pandemic. It is considered an important practice in which reducing the transmission of infectious agents which cause hives. So, when hands are visibly dirty or contaminated with biologic material from patient care, hands should be washed with soap and water. In intensive care units and other locations in which virulent or resistant organisms are likely to be present, antimicrobial agents like chlorhexidine gluconate, iodophors, chlorosilinol, and triclosan may be used. Effective hand washing requires at least 15 seconds of vigorous scrubbing with special attention to the area nail beds and between the fingers where there is a high bacterial burden. So if hands are not visible soiled, healthcare providers strongly encourage to use alcohol-based, waterless, antiseptic for routine hand decontamination. So, when we comparing the hand hygiene method in alcohol-based product and hand washing, so in alcohol-based product, after contact with body fluid, excretion, mucous membrane, non-in-contact skin or wound dressing as long as hands are not visible soiled. So after contact with patient's intact skin or after taking pulse or blood pressure or lifting a patient, after contact with inanimate object in the patient's immediate vicinity. Yan po yung sa alcohol-based product. In hand washing, when hands are visible dirty or contaminated with biologic material from patient's care. When healthcare workers not tolerate waterless or alcohol product. So, we have here the areas frequently missed during hand hygiene. In red color, we have here the most frequently missed. Yan. Frequently missed is the yellow, and the light blue is less frequently missed. So, the nurse in the hospital now is using the PPE or the personal protective equipments to reduce the transmission of the patient in virus. So, we have here the eye protection, the mask, the gown, and the gloves. They use it to prevent the transmission. So, they use the gloves to provide an effective barrier for hands from micropara associated with patient care. In gloves, they should be worn when a healthcare worker has contact with any patient's secretion or excretion and must be discarded after each patient care contact. So, you need to wear your gloves when touching the blood, body fluid, secretion, excretion, the mucous membranes, and non-in-contact skin. You need to change between the task and procedure on the same patient after contact with potentially infectious material, and remove it after use and before touching non-contaminated items and surfaces, and before going to another patient. In gloves, you need to perform hand hygiene immediately after removal. So, glove must be worn when exposure to blood, as I can say it lately, that you need to wear it when exposure to blood or other body fluids, which is anticipated. Change immediately after each patient. Change it if perforation or puncture is suspected, and appropriate for use, fit for purpose, and well-fitting to avoid excessive sweating and interference with dexterity. So they use also the gowns and aprons. Why would they use it? So they wear an apron or gown to protect skin and prevent soiling of clothing during procedure and patient care activities that are likely to generate a splashing or spray of bloods, body fluid, secretion or excretion, and or cause soiling of clothing. They select a gown or apron like long or short sleeve that is appropriate for the activity and the amount of fluid likely to be encountered. If an apron is used, staff should ensure that are bare below the elbows, and they remove the use of gown as promptly as possible and roll it up carefully and discard appropriately. So they perform hand hygiene immediately after removal. We have here the prevention of needle stick and injury from other sharp instrument. So, prevention of needle stick and injury. It is important aspect of reducing the risk of bloodborne infection is avoidance of percutaneous injury. Extreme care is essential in all situations in which needles, scalpels, and other sharp objects are handled. So, they use needle and should not be recupped. Instead, they are placed directly into puncture-resistant containers in the vicinity of their use. So, prevention of needle stick and injuries, they use care when handling needles, scalpels, and other sharp instruments or devices, and cleaning used instrument, disposing of used needles and other sharp instruments. So, facial protection. When we say facial protection, it is included the eyes, nose, and the mouth. When the healthcare provider is involved in an activity in which body fluids may be sprayed or splashed, Inappropriately, barriers must be used. If a splash to the face, it may occur, the goggles and face masks are warranted. If the healthcare worker is handling material that may be soiled clothing or is involved in a procedure in which clothing may be splashed with biological material, and a cover gown should be worn. Next. Linens. Linens handle, transport, and process use linen in manner which is prevent the skin and mucous membrane exposure and contamination of clothing. And it avoid transfer of pathogens to other patient and or other environment. So handling of patient of care, equipment and linen, they handle the equipment soiled with blood, body fluid, secretion and excretion in a manner that prevents skin and mucous membrane exposure, contamination of clothing, and transfer pathogens to other patients or the environment. They clean, disinfect, and reprocess reusable equipment appropriately before use with another patient. So waste disposal. In hospital, they have a waste disposal to ensure the safe waste management and treat waste contaminated with blood, body fluid, secretion, excretion as a clinical waste in accordance with local regulation. Human tissues and laboratory waste that is directly associated with specimen processing should be treated as a clinical waste. So discard single-use items properly. Environmental control. Ensure that the health service has adequate procedure for the routine care, cleaning and disinfection of environmental surfaces, beds, bed rails, bedside equipment, and other frequently touched surfaces, and that these procedures are being followed. So they use adequate procedure for the routine cleaning and disinfection of environmental and other frequently touched surfaces. In respiratory hygiene and cough etiquette, the education of health workers, patients, and visitor. They covering their mouth and nose when coughing or sneezing. Hand hygiene after contact with respiratory secretion. Spatial separation of person with acute febrile respiratory symptoms. So we have here the transmissions-based precaution or the TBP. It is used in addition to standard precautions when standard precautions alone may be insufficient to prevent transmission of infection. So TBP are used for patients known or suspected to be infected or colonized with epidemiologically. And it is important or highly transmissible pathogens that can transmit or cause infections. So the TBP or the transmission-based precaution are not required for patients with blood-borne viruses such as HIV, hepatitis B virus, or hepatitis C virus. So the type of TBPs applied is based upon the mode of transmission of pathogens. So for diseases that have multiple routes of transmission, more than one TBP category is applied. So the following are the routes of transmission. The airborne, which is included the pulmonary tuberculosis, the chickenpox, and the measles. Next is the droplet transmission, which is included the influenza, pertussis, or whooping cough, and rubella. Next is the contact transmission or direct or indirect. Example, the viral gastroenteritis, Clostridium difficile, MRSA, and the scabies. So we have here the conclusion that the standard precautions are the work practices required to achieve a basic level of infection prevention and control. The standard precautions are the minimum infection prevention and control practices that must be used at all times for all patients in all situations. So, while the transmission-based precautions are used when standard precautions alone are not sufficient to prevent the spread or infection agent. Entrance-based precaution are based upon the mode of transmission of the infectious agent. That's all. Thank you.